South African virologists say Mpox outbreak in Africa was neglected and it could now turn into the next global pandemic. They say the outbreak in Africa is yet another example of how infectious diseases are perceived to be someone else's problem. Over the weekend, President Cyril Ramaphosa expressed deep concern about the rapid spread of Mpox across the African Union region. Last week, 3 additional countries notified cases under investigation for confirmation, which brings the total to 16 countries in which Mpox has been detected. For more, we are now joined virtually by the head of the Division of Medical Virology at Stellenbosch University, Professor Wolfgang Preiser. Prof. Preiser, thank you very much for joining us. It's good to have you here on Morning Live.
Good morning. Thank you. Good morning.
It's quite scary to read anything, especially South Africa and the world coming out of COVID, when you start hearing things like the world saying that with Mpox outbreak in Africa being neglected, it could turn into the next global pandemic. But perhaps you can elaborate a little bit on this for us.
With pleasure. Yeah, Mpox is a infection and a disease, a virus that we've known for more than 50 years. But unfortunately, it received very little attention in terms of research and in terms of coming up with diagnostic tests, treatments, and vaccines. And there was a rude awakening just over 2 years ago when a different strain, a different lineage of this virus, of the monkeypox virus that causes Mpox, emerged and spread globally, affecting more than 100 countries, most of which had not previously reported any cases. And that was a first wake-up call that should have told the global community that if you think it is a rather obscure African problem, think again, because it may still change, and out of nowhere, seemingly, this virus may pose a challenge. Yeah. Now, that first outbreak is largely under control. That said, we had over 20 cases this year alone in South Africa, including, very regrettably, 3 people who died from that. But by and large, we know how it's transmitted, and there has been a lot of progress. So numbers have come down, but the virus is still there and will probably continue to be there forever. Yeah. Now, that the current one, which is our big concern, is a different strain of that same monkeypox virus. And whereas before we thought it is something that one acquires by contact with small mammals that carry this virus naturally, it now seems that also in the Great Lakes region in eastern DRC, this virus is being transmitted from person to person. And that, of course, puts it on a very different level. And we've already seen spread to neighboring countries. And unless something is done about it urgently, there is, of course, the clear risk that this virus will be spread internationally as well. And that is what we are trying to prevent.
So we have, I mean, obviously, I don't know if those numbers have increased, but we do know that in terms of the numbers, there are about 17,000 cases that have been spoken about here on the continent, but outside of the continent, there are 2 cases that we know of. I think one in Sweden and one in Pakistan. But I'm not sure if there are any more of these, and what strain are we dealing with here?
Yeah, we are dealing with this so-called clade 1b virus, which is of the 2 strains that there are, clade 1 and clade 2, is the more dangerous one. It's the one that causes more severe disease and also is more likely to lead to death. And that is the one that is now has now started spreading from human to human. I'm not quite sure whether the Pakistani case has been confirmed as belonging to this very clade. The one in Sweden has, and it's only expected that there will be a further international spread of this virus. And the big challenge is to prevent this from turning into a global outbreak. So basically, cases need to be recognized early and then put in isolation and need to be treated. And contacts can also be vaccinated. There is an available vaccine, but there isn't enough of it. And particularly, it is usually not available in most of Africa where it is most needed. And that is what we need to do now.
Yeah, I mean that's where the big problem is, and it feels like once again the history repeating itself in terms of a lack of vaccines, and the African continent is the one that needs it most, and yet cannot get hold of it, and this is a major problem. And I know that our president Cyril Ramaphosa, speaking to a SADC gathering, outlined this and again spoke of the desperate situation that we find ourselves in as a continent, and it's being called apartheid vaccines. And this is a big problem. So how bad is the situation? I mean, again, reading figures saying that on the continent we need about 10 million vaccines, but we only have access to about 200,000.
Yeah, well, there aren't that many vaccines available globally even. Firstly, because they were produced in anticipation of a possible bioterrorist or biowarfare attack using pox virus. So they are basically left over from that attack. There was a stockpile. But again, much of it has been used to control the global outbreak that happened 2 years ago. And that was largely successful. So there isn't that much left, and producing more will take time and effort, and of course needs substantial funding. And that is the big challenge, because now we are talking of a population of several million people that could benefit from that vaccine if they had access to it. May I just add, regarding the figures, you will find different figures circulating regarding the situation in Eastern DRC. The reason is that in order to be counted as a confirmed case, you need to be tested for the virus. And that is where the problem starts, because the majority of cases have not been tested for the virus with a laboratory test, simply because there isn't it's not available. There isn't the facilities to do that. And that's the first challenge. So the large figure is actually suspected cases. Some of them may not have this infection, others will go unrecognized, but we don't even have enough testing being done currently in order to recognize the magnitude of the problem. And without testing, you don't really know that well how it is spread, who is affected, where it is going. So that's one of the things that also need to be done urgently. We need to get tests on the ground. And that's quite something, because these are PCR tests. So it's unfortunately not a simple rapid test like we knew it from COVID times. This requires more. It can be done, but it requires a major investment and lots of resources to be deployed in order to understand who is infected, who would benefit, who are the contacts who could benefit from vaccination. So that's just one component of a much bigger intervention that is needed.
Yeah, I know the World Health Organization had committed a sum towards it and said that it may in the next couple of days add more to what has already been put into that fund. But one does know that it's probably not enough, certainly not where we're seeing quite a dramatic spread of this. I mean, we don't want to create alarm, because I think that's, we've learned that lesson. We need to be very mature about the messages that we put out there. But certainly with numbers showing that, since the beginning of this year, I think we've already seen 517 people on the continent that have died from it, 17,000 suspected cases in Africa. So it certainly is growing. Is it cause for alarm? Or are we sort of just educating ourselves at this point?
Absolutely. No, I agree with you. It's something that people need to be aware of. So that if cases occur, and fortunately here in South Africa, we have very good structures for testing. So various laboratories, including the NICD's lab, can test for it and do so. And what we want is a situation which we have probably achieved at the moment, in where people are aware of it. And if there is a suspicion of Mpox, they will send specimens for testing, and then more often than not, these tests are then negative, which is a good sign, because it means that potential cases would be recognized. And I'd rather have 20 people who are tested unnecessarily because they turn out to be negative than one person that is missed. So that's a good sign. And it's really to keep that awareness. And then if a case really occurs, to recognize it early and to prevent further spread. And of course, to give the patient the best possible treatment. We have antivirals available in the country, not very many, but enough for now. So we can even treat patients to prevent the worst outcomes. So Yes, I think one needs to be careful, and the effort at this stage should really be directed towards the area where this is already rampant, Eastern DRC. And if you look at the latest report from the Africa section of WHO, in this region, apart from ongoing civil and other wars and violent unrest, they are dealing with flooding. They're dealing with a variety of different infectious outbreaks, including cholera, measles, 2 strains of poliovirus, and now on top of it, also Mpox. You can imagine how difficult an area this is to work in, how under-resourced it is, and what a big challenge it will be to actually deploy the necessary laboratory and clinical facilities on the ground. The good news is it has been done before for Ebola, which raged there for over 2 years and came to an end in 2019 with a massive concerted international effort. So it can be done, but it requires major efforts.
Yeah, it certainly does. And I mean, because when we look back at the history of the Mpox virus, I mean, it was considered a zoonotic disease, endemic to parts of Central and West Africa. And it's only now that we're seeing cases outside of the endemic areas and this new strain that you speak of, these different clades. Did it come as a surprise, this outbreak?
Yes and no. I think that as a virologist and a public health person, we are trained to expect the unexpected, and we've seen this before. But this shift from being an infection which is acquired through very clear risk factors, i.e. going out and hunting small mammals, often for the bushmeat trade, and then consuming them, which is quite defined and only occurs in certain areas of tropical Africa. So, that is the reason why there wasn't major international concern about it. But in fact, since 2017, there was evidence in Nigeria of human-to-human transmission, where if you ask people who are infected, what did you do? What did you engage in? There was no contact with any wild animals or any bushmeat markets, and it was very clear they had acquired it from another person. And that is the outbreak which built up there in Nigeria since 2017, and then 5 years later in 2022. It hit the global scale. It went to over 116 countries in virtually a few weeks and a couple of months. So these things can happen, and we just don't want this repeated with the current Eastern Congo outbreak, because the virus there is more dangerous. It has a higher mortality, so people are more likely to develop severe disease and to die from it. And if we let it smolder in the areas where it is rampant now, of course it's a humanitarian issue in the first place, but there is also the risk that the virus builds up momentum and sooner or later gets spread more widely and possibly globally. And that is really what we can still prevent, and we have to do this now. Otherwise, we're going to be dealing with a big problem in a few months to maybe a few years from now.
So clade 1 is the one of major concern at the moment. In terms of its spread, how is it spread? Obviously, we do know that it's we've been speaking about it being sexually transmitted and other ways. But I'd love you to give a bit more clarity again, because these are things we need to talk about. Is the spread and the signs to look out for if you have in fact got it or picked it up.
So spread is through very close contact, intimate contact, including sexual contact, probably also in a family setting, in a household setting. It's fortunately not extremely contagious. So it's not a virus, unlike SARS-CoV-2 that caused COVID or influenza. It's not something that you can catch by just sharing a ride in the lift or a ride on the bus. In a taxi with somebody. So it requires a more close contact for transmission, which is very good. So we are not talking of the same level of spread and the rapidity of spread that we've seen with COVID. But still, close contact does happen, and intimate contacts, of course, also happen. And while the rash can be quite extensive and a clear sign of alarm. I mean, any person would recognize that, there's something is really wrong here. We need to get medical care, need to find out what that is. It can also be more discreet. And in fact, quite a few of the people who got it don't remember who gave it to them, from whom they became infected, which means that the lesions were very discreet and probably mistaken for something else. And the contrary also holds. I mean, many cases, you might have seen 2 weeks ago or so, there was a moment of panic in South Africa about a pupil, a learner at a school with Mpox and school being quarantined. That was, of course, not Mpox, that was chickenpox, which can look very similar. Yeah. And so, one needs to also look into these cases properly to see, is it truly Mpox or not? And then if it could be, to test. So it's close contact with people. And at the moment, we would still expect a close link to the country of origin. So if somebody has been traveling and has been to Central Africa, is now returning with a rash that seems unusual and that I haven't had before, this is now clearly a reason to check it out.
Yeah, all right. Thank you so much, Prof. Thanks for giving us all of this information about Mpox. Prof. Wolfgang Preiser, he is the head of the Division of Medical Virology at Stellenbosch University, speaking to us about the implications of Mpox and the outbreak in Africa if it continues to be neglected, and the big problems associated with it. So just keep vigilant, keep your eyes open, and know that this is doing its rounds. Certainly not an alarming interview or something to be alarmed of, but something to be very cautious of and note those symptoms as well and how it is spread. So it's very, very important for you.